Welcome to Practice Plus Group Hospital Plymouth Endoscopy Unit. In this video, you will follow a patient through their journey from referral to arriving and completing the endoscopy procedure with us. Once we have received the referral from your GP or consultant, we will then review the information and discuss symptoms, past medical history and medication with you over the telephone.
So your GP has asked us to give you a call because he or she was worried about what was happening with your bowels.
During this discussion, we ascertain which would be the safest and most appropriate test to book for you. You will then receive another telephone call within a few days from a member of our pre-assessment endoscopy team.
My name's Cherie from Practice Plus Group Hospital. I'm calling today to do your pre-assessment.
The telephone assessment is to give you more information about your procedure. We will discuss the low residue diet you need to follow 3 days before you're due to have your procedure, oral bowel preparation medication, and if appropriate, how to administer a disposable enema prior to coming in on the day. If you need to stop any of your prescribed medication, we will also go through this with you. There is a choice of light sedation and/or Entonox, which you can have during the procedure to help manage any discomfort you might experience during the test. If light sedation is preferred, you will need to have someone collect and stay with you for 24 hours after the procedure. During this time, you are also not advised to drive or work as the medication wears off. If you choose Entonox on its own, you can drive 30 minutes after your procedure and continue with your normal routine. You will also be asked if you have any concerns, questions, or would like a further explanation of anything to expect. On arrival, you will be greeted by one of our reception staff.
Good morning, how can I help?
Who will mark you as arrived and direct you to our endoscopy waiting area.
If you'd like to come with me, I'll show you where you need to go.
The person accompanying you can either wait upstairs with you in the endoscopy waiting room, sit in our cafe area downstairs, or leave and come and collect you after your procedure is finished.
Hi, is this Eve?
Yes.
Hi, if you'd like to follow me, I'm going to take you through to where we're going to do your pre-admission.
Soon after arriving, a healthcare assistant will come and collect you and take you through to a private room where we will check to see if there are any changes since your pre-assessment and do some observations of blood pressure, pulse and temperature. Afterwards, we will then check which sedation you have chosen to have, and if it's light sedation, we'll document who is collecting you.
If you'd like sedation, we need to check a few things. Have you got somebody collecting you today?
Yes, I have.
Yeah.
From there, we will then take you through to our single-sex waiting area, which has a toilet facility available, 3 separate cubicle areas, and our consenting room to maintain your dignity and privacy. You will then be directed to change into your gown and the dignity shorts you will wear during your procedure. If you are wearing a short-sleeved shirt or t-shirt, you can keep these on under your gown. Each of the cubicle areas has a red cord bell you can pull at any time to alert our staff if needed whilst you wait. It is advisable to bring some reading material with you as you can be on the unit for 2 to 3 hours. There is also a television in both the waiting areas. A member of the endoscopy team will keep you informed if we have any delays on the day. Our consultant will then come and meet you and take you through to the private consenting area to discuss the procedure and check you are still happy to proceed.
Good morning, I'm Simeon Brundle, I'm one of the consultants here at Practice Plus.
After which, you will both sign the consent form. They will then escort you through to the procedure room where you will meet the rest of our team and have your test.
Hi there, Eve. My name's Cherie. I'm helping a consultant today. I'm just going to do some checks before we get started, okay?
Yeah, sure.
The procedure room contains a lot of specialist machinery and monitoring equipment. Don't worry, this is here to keep you safe. You will be introduced to the team and asked to confirm your identity. The team will then run through some pre-procedure checks and make sure you are comfortable on our examination trolley. If you have decided to have the light sedation, a cannula will be inserted into your arm. If you have chosen to have Entonox, the nurse will go through how to use the mouthpiece, where you can take a few practice breaths so you know how to use the equipment. The nurse will remain by your side throughout, making sure you are comfortable and to answer any questions you may have during the procedure. You're able to watch the test on the screen if you want to. Once the procedure is finished, you will be taken on the trolley through to the recovery area. Once you are in the recovery area, the recovery staff will take a handover from the nurse who has been sat with you for the procedure, and you will remain on the trolley sat up to rest for a minimum of 30 minutes, whilst we check your observations. During this time, we will also offer you some refreshments and biscuits and make sure you remain comfortable. If you have had sedation, we will ask you to call whoever is coming to collect you so that we know they are in the hospital. Once the observations are completed, we will remove your cannula if you had one and will leave you to get dressed. Once dressed, the nurse will describe your results and you will be given a copy of the procedure report, advised of any actions that are needed, and go through our discharge advice sheet. If you would like to have someone with you at this point, we can accommodate this in a room away from other patients who may also be in recovery. We will also ask you to complete our friends and family survey. We aim to keep your experience on our endoscopy unit as safe, dignified, and as comfortable as possible. And we always welcome feedback so we can improve and maintain our service for patients in the future. Thank you.